Good afternoon, everyone. Joining me today is the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. To her right, the state's former epidemiologist and current COVID-19 response medical advisor, Dr. Eddie Bresnitz. Eddie's with us most Wednesdays these days. Great to have you both as always. The guy to my left, who needs no introduction, the Superintendent, I was going to call you a commissioner there, Pat, the Superintendent of the State Police, Colonel Pat Callahan. We have Jared Maples, Director of the Office of Homeland Security and Preparedness, Paramount Garg, Chief Counsel, and a cast of thousands. Before we get in today, a couple of notes to the side. Number one, I want to give a shout out to a very dear friend and an old friend and former colleague, Mario Draghi, who has formed a government and is now the Prime Minister of Italy. I think he's, if I may say so, the exact right guy at the right time for that great country. Secondly, we did a couple of events over the past 24 hours or so that I think have huge impact potential, in some cases in the here and now, and in some cases over time, to different parts of communities in New Jersey. One is yesterday we announced that we had taken $94 million that came back to New Jersey from the Regional Greenhouse Gas Initiative, $94 million, plus another $45 million from the Volkswagen settlement that was New Jersey's, and basically bought a ton of municipal big equipment, all of which is electric. And then, if that weren't enough, put some money in the street to invest in charging infrastructure. So we were in Newark yesterday with the great Mayor Ras Baraka, and we had a huge electric garbage truck right behind us as an example. You can go on the nj.gov website, Mahan, I believe that's it, nj.gov, and you can find the list of the amount of equipment and the number of communities that are getting electric heavy-duty equipment and electric charging infrastructure. Really, really a special announcement. And then separately this morning, thrilled to be in Camden, announcing with the Commissioner of the Department of Transportation, Diane Gutierrez-Scacchetti, and elected officials, Mayor Frank Moran, Senate President Sweeney, Congressman Donald Norcross, many others, that NJ Transit and the state are going to invest $250 million into the Walter Rand Transit Center, which is a really important center because it's basically the gateway to South Jersey. It's got about 24 bus lines that go in and out of there every day. It's got the River Line, which is the light rail, important line from Trenton down to Camden. It's got the Patco connection into Philadelphia, and there's enormous potential. Walter Rand was a big deal, a Camden native, assemblyman, senator, really one of the fathers of infrastructure, the Transportation Trust Fund. This is going to transform the infrastructure in and around this transportation hub, and Camden will be a big winner. The region, frankly, will be a big winner. So I just want to get those thoughts off my chest. I want to give a shout out, a quick shout out if I can, to all the schools who worked so hard to safely welcome parents back into your gyms and rinks to cheer on their student athletes. We had, based on the evidence that we have, which is largely anecdotal, I don't think you've got any to the contrary, we had a very good first weekend of competitions, and I'm confident that school leaders and athletic directors and their teams will continue to ensure that parents can safely attend these sporting events. I don't know how many tweets we got, but we got a lot of tweets at us, photographs of custodial and other staff, athletic director staff, putting the protocols in place, and it was really encouraging. Another note to start our day today, I'm signing an executive order extending the public health emergency for another 30 days. As we have noted many times before, unless it's extended, these emergencies expire actually after 30 days. I want to, in particular on this extension, emphasize, Judy, you would want me to do this, that among other important measures, the Department of Health's ability to regulate the distribution of the vaccine is linked to the declaration of a public health emergency. Failing to extend the public health emergency risks compromising the department's ability to prioritize high-risk individuals, promote adequate staffing at vaccination sites, and ensure that residents are receiving the correct second dose of their vaccine, among other important steps. So today's action means that we can continue our ongoing COVID-19 mitigation efforts while also vaccinating New Jersey residents as quickly and as safely as possible. And before we move to the numbers, including vaccine numbers, I want to acknowledge the news from the Biden administration that it will rescind the policy instituted under the Trump administration that had made it more difficult for local partners, like New Jersey, to fund large infrastructure projects like those included in the Gateway program. Unfortunately, the Hudson Tunnel project, which is really the biggest piece right at the center of the Gateway program, it languished over the past 4 years as the Trump administration refused to accept the commitment to the project made by President Obama that federal loans taken by local partners would contribute to the local share for the project. I recently raised this issue directly on a call with now Transportation Secretary Pete Buttigieg, and I'm pleased to see this action taken as a result. And frankly, I'm not surprised. Pete, who I've known for many years, got this immediately. Think about this. If I borrow money and I use the proceeds to be part of my local commitment and I have to pay the money back, that's real money. That's money good. And the fact that that was denied for 4 years under the prior administration is really frustrating. But this is a good result, at least in the here and now. So yesterday's action will provide much needed flexibility for the financing of the Gateway program and other Northeast corridor projects, including for the construction of the sorely needed 2 new tunnels under the Hudson River. Now that this impediment to progress is removed, and I look forward to working with Secretary Buttigieg and his team and with the Biden administration to finally get the Hudson Tunnel project back on track. We need these new tunnels. Our economy needs it. Our commuters need it. Our entire region needs it. And by the way, they will spin thousands of good-paying union jobs, among other benefits. Now, moving to our vaccination efforts, the dashboard is showing, Judy, I've got 1,470,941 administered doses as of this morning. So far of that amount, just about 1,060,000 New Jerseyans have received at least their first dose. Cracking the 1 million dose threshold was a significant accomplishment. And as of this morning, more than 412,000 New Jersey residents have also received their second doses and are now fully vaccinated. Each day, these numbers move upward by several tens of thousands. It is consistent progress. We know there remain many, many residents who want to be included in these numbers but aren't yet because of the scarcity of appointments due to the scarcity of vaccines. We hear you and we understand your anxiety. We remain committed to doing everything we can to improve the platforms available for scheduling your vaccination appointment, and we remain committed to working with the federal government to receiving every single dose we can and then maximizing those doses. We will get there. There's just no question in my mind, I think collectively in our minds. Every single New Jerseyan who wants to be vaccinated will be vaccinated. But at the moment, with only 2 approved vaccines currently on an emergency use basis at our disposal, we all need to continue to be patient as doses continue to roll out. And again, we will get there. I spoke to a union leader this morning, a dear friend of mine. We haven't heard one bad case for why certain populations that are not currently up to bat should be up to bat. So everyone is making a very credible case on behalf of their colleagues, regardless of who you might be or which community you might be in. Remember one thing that I think, Judy, slips beneath the cracks too often. If you're under 65 and you have a chronic health condition, you are right now up to bat. You are eligible to get a vaccine. Whether you're an educator, a transit worker, a longshoreman, a retail worker, regardless of who you are, if you've got a chronic condition, you are eligible right now. So, in the meantime, in addition to getting more and more vaccine supply and getting more and more administered in shots in arms, we must encourage everyone to continue to practice social distancing, to keep wearing their face masks. I've now graduated to 2. Especially when I'm inside. And by the way, face masks, period, especially when you're indoors where it is required, except when you're either eating or drinking. And we want folks also to continue to use common sense. I know it's the basic stuff that we've been preaching from day one, but the basic stuff is still the hand we've been dealt. Remember, we cracked the back of the curve in the first wave without a vaccine because we did that basic stuff by the millions in this state. We need to continue to do that, and then if that weren't enough, we've got the vaccine. and that's going to help us crack this even further. And even if you've, by the way, recently, Eddie, unless you disagree, even if you've recently received a vaccine, it is still just as vital that you continue to do these basic things as well, as it takes time for your body to build up the defenses and to work with the vaccine. As we noted here last week, we continue to encourage residents to get tested. Testing remains a vital tool at our disposal, just as vital in many respects as the vaccines, to helping us get the data we need so we can make fully educated decisions on reopenings and potentially relaxing other restrictions, or even where we may need to head in to stamp out a potential hotspot. And aside from testing and following the routines that we have all made part of our daily lives, we would encourage you to download the COVID Alert NJ smartphone app, which has just received a significant update. In addition to more efficient data presentations within the app is now also available in 10 languages beyond its initial rollout in English and Spanish, and is now more accessible for speakers of Arabic, Chinese, Gujarati, Haitian Creole, Hindi, Korean, Polish, Portuguese, Russian, and Tagalog, all languages we hear across our state. So again, we ask you to download the COVID Alert NJ app and add your smartphone to our fight against the virus. One more reminder before we get to the overnight numbers, and that is that the application window for small businesses to apply for the New Jersey Economic Development Authority's Small and Micro Business PPE Access Program is now open. And this is for businesses with up to 100 employees. Through the PPE discount program, participating small businesses could save up to 70% on purchases of personal protective equipment for their employees and customers from participating vendors. In the PPE discount program's initial run, roughly 9,000 small businesses collectively saved more than $7.6 million. We want to ensure that more small businesses avail themselves to these savings. And again, if you participated in the prior PPE discount program, you don't have to do a thing to rejoin. You're automatically eligible for this round of savings. Business owners who need to apply should visit that website, covid19.nj.gov/PPE access. And once your business is approved, the discount will automatically apply to your online order, so there is no need to keep receipts or submit paperwork. The PPE discount program is just one of the ways the EDA has stepped forward to help our small businesses weather the pandemic. It has also released hundreds of millions of dollars in direct grants and loans to literally tens of thousands of small businesses and nonprofit organizations. Let me give you an example. One of the beneficiaries is the Camden-based, this is a very cool organization, by the way, Symphony in C, which has been a part of South Jersey's cultural landscape since its founding as the Haddonfield Symphony in 1952. Symphony in C is just one of 3 professional training orchestras in the entire United States. Ensembles which prepare musicians and conductors for careers in the fine arts through performance, educational research, and professional development programs. Pat is a graduate. That's not true. Just want to make sure you're paying attention. This mission, preparing tomorrow's musical leaders, has been Symphony in C's core mission since 1987. Needless to say, the pandemic hit our arts community especially hard, and Symphony in C has received 2 grants from the EDA that have allowed it to keep up with the payroll. But the Symphony continues to face continued challenges, and we remain committed to helping in any way we can. I had the great honor, I think, last Friday of speaking with that woman, the president, Pamela Brent. I also would encourage each of you watching, if this grabs you, if you have the means to support their mission of arts education through music, go to their website there, Symphony in C, symphonyinc.org. New Jersey has a long and storied history in the fine arts. Let's keep it strong for future generations. With that, Judy, let's go to the overnight numbers. So we'll begin with a case update. 4,495 positive test results. These break down into 3,786 positive PCR tests and 709 presumed positive rapid tests. The percent positivity, this was a low day in the number of tests, 18,835 recorded on Saturday, was 10.8%. Again, we tend to have lower number of tests on the weekend. We think folks are getting tested on the weekend for a reason, maybe that they've been exposed or they're symptomatic. And either way, that positivity rate, which Judy had been really hovering in the 7 to 8% range for the past number of days, is up a little bit. Rate of transmission, 0.91, also up slightly. In our hospitals, as of last night's reports, a total of 2,370 were being treated. 2,203 of them were known COVID positive. 167 were awaiting their test results. Intensive care, 411 beds filled, 309 ventilators in use. These numbers, it's unmistakable, all continue their recent downward trend, which is a very promising sign. I know you're going to talk about variants, but obviously that's a wild card that we're watching like a hawk. Yesterday, 301 live patients were discharged, 353 were admitted, and at the risk of comparing apples to oranges because they're not confirmed, 42 in-house fatalities. But we can say with a heavy heart that we are reporting another 92 confirmed losses from our extraordinary New Jersey family due to COVID. Our total confirmed deaths, you can see, is 20,343. And we must also include the 2,289 probable deaths. When you add that up, it's a staggering 22,632 losses of life. To ensure that none of those we have lost ever becomes a mere number, let's honor the lives of 3 more of the proud New Jerseyans who we've recently lost. We want to begin today by remembering Michael Mickey Beard, a resident of Kearney and Waretown. Mickey, as he was known, was a gifted athlete who was a 4-sport varsity letterman at Kearney High, a sporting legacy that earned him induction into the Kearney High School Hall of Fame in 1994 for soccer. After earning a degree in public health from Montclair State University, Mickey embarked on a career as a sanitation and environmental technician with the Kearney Health Department, a job he remained dedicated until his retirement in 2008. Mickey leaves behind that woman right there, his wife Diane. I had the honor of speaking with Diane on Friday. She also was COVID positive, but had a much milder case. And by the way, I believe I'm right. She'll correct me if I'm wrong. That picture is from their renewal of vows in 2009. They were married for 39 years. Mickey also leaves behind his daughter Caitlin and her husband Mark, and they tragically lost their son Ryan. That is, Diane and Mickey lost their son Ryan in the year 2016, and we now know that dad and son are reunited. Mickey's also survived by brothers Jack and Billy and their families, and also by his mother-in-law Rosemary. He was a Jersey original. His last words to Diane as she was leaving were literally, and I quote, "Don't be knuckleheads. Don't be knuckleheads." Bless him. We thank Mickey for a lifetime committed to his hometown and to our state. May God bless him, watch over him and his family. Next up, we recall Kevin Brophy, who passed away on February 3rd at the age of 73. He was a Queens native who called New Jersey home for the past 46 years. Why Jersey, you may ask? The reason for leaving New York for our side of the Hudson was his marriage to his wife, Mary, in December of 1974, which led to their move to Clifton to start their family. After nearly 20 years in Clifton and another 17 in nearby Wayne, Kevin and Mary retired to Manasquan in 2006. Only fitting that it was Manasquan. They first met in Manasquan, so theirs was a true Jersey Shore love story that came full circle. Kevin was a successful businessman in the field of healthcare finance, but among his family and friends, he'll always be remembered for his Catholic faith and his Irish warmth and wit, his love of the New York Yankees and the New York Football Giants. He was a Giants season ticket holder for many years, and his love of family, especially his grandchildren. He is survived by his wife, Mary. I had the great honor of speaking with her again on Friday. Judy, she's a nurse. You'll be happy to know. She also had COVID, but again, much milder. He's also survived by their 3 sons. Daniel, I think, is in Ridgewood, who's in technology. Thomas is a lawyer at the Port Authority, and Matthew's electrician. And by the way, they're all in Jersey. And their families, by the way, including Kevin's 5 beloved grandkids, Leah, Jack, Grace, Alexandra, and Kevin. He also leaves his sisters Marianne, Teresa, and Agnes, as well as numerous nieces and nephews and countless friends. May God bless and watch over you, Kevin, and the family that you leave behind. And finally, for today, we honor this guy, a giant, Eugene Marsh of Pennington. So Eugene was born and raised in South Carolina. He was the first black student to integrate his all-white high school. Think about that courage. He was a decorated Vietnam veteran, earning the Distinguished Vietnam Medal, Army Commendation, and the Bronze Star Medal for valor in combat. His life eventually brought him to New Jersey, where he started his construction management firm, where he also met his future wife, Elaine, in 1995. In 2012, another milestone here, his company was the first black-owned firm selected by the federal government to work on renovations at the Statue of Liberty. But even with a successful business, Eugene went back to school to pursue the college degree he had never attained, and an entirely new field, by the way, as well, one that would get him working with his fellow veterans. At Rider University, he would earn both his bachelor's and master's degree in clinical mental health counseling. Isn't that extraordinary? In 2014 and 2018, respectively. But he wasn't done. And at the time of his passing, Eugene was studying, again at Rider, toward a doctorate in educational leadership. His focus again was on mental health disparities among veterans. I want to thank our friends at Rider, by the way, for bringing Eugene's extraordinary life and passing to our attention. Even though the pandemic cut short his ultimate dream, Eugene had already left a tremendous mark, as he was the 2018 recipient of Johnson & Johnson's Dr. Martin Luther King Jr. Community Service Award for his work and engagement with vulnerable populations. He leaves behind his beloved Elaine, with whom I had the great honor of speaking on Friday, as well as his siblings, Charles, Michael, James, Francesca, Esther, and Susan, and his foster siblings, Jeffrey, Kendall, Maylene, and Jackie, among a tremendous list of nephews and nieces, cousins, in-laws, and friends. We thank Eugene not only for his service to our nation, but to our state, and particularly to our veterans. His story should be an inspiration to all, that you are never too old to keep learning. Eugene was 71 years old. God bless you and watch over you, my friend. 3 more of the lives lost to this horrible pandemic. We are all optimistic, let there be no doubt, for better days ahead. But it is always important to remember those who will not be with us to celebrate those days. We will never forget Mickey, Kevin, or Eugene, or any of those we have lost. And finally today, unrelated to COVID, I would be remiss if I did not note a passing from among our family in the governor's office. Early today, we lost Edwina Davis, that woman on the left, who had served for nearly 30 years on the administrative staff within the governor's and the council's office. She joined state service in 1992 after a career that included stops as an educator and in the hospitality and public relations industries. She was hired in the administration of Governor Jim Florio. And while the names on the doors changed every few years, Edwina's didn't. She worked under not just Governor Florio, but under Governor Whitman, DeFrancesco, McGreevey, Cody, Corzine, Christie, and yours truly. I think it's fair to say that there's not anyone who worked in the front office in any of the 8 administrations she served who doesn't have an Edwina story to tell. She took on the role of ambassador of the governor's office. She was an institution within the institution. Even during the pandemic, and even at the age of 82, Edwina did not want to sit still or sit this out. We are keeping her husband Warren and her children Lori, and so this is First Lady Tammy Murphy hanging with Edwina on the left and her daughter Lori on the right. Also her daughter Wendy and son Michael. We're keeping them all in our prayers today. Edwina was an extraordinary and amazing spirit. We miss her deeply. Thank you for all that you did, Edwina, and may God bless and watch over you. We'll handle things as best we can from here. And with that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. As the Governor shared, the number of vaccine doses administered in the state continues to increase. The 6 megasites reached a new milestone yesterday, administering 201,872 vaccine doses. The Gloucester County megasite alone has administered more than 60,000 doses to date. Yesterday, the sites also reached a new single-day high, administering more than 13,000 doses in one day. These sites are playing an essential role in supporting our goal of vaccinating 70% of the eligible adult population. They are doing their work in collaboration with our major hospital systems, Hackensack Meridian, Atlantic Health, Robert Wood Johnson Barnabas, Atlantic Care, Virtua, and one of our universities, Rowan of South Jersey. As vaccinations are underway, there have been some challenges due to the weather affecting the country. Vaccine shipments this week have been delayed due to the storms that are moving through the United States. We're closely monitoring the information coming from the CDC on our shipments. Most vaccination sites in our state have been using inventory on hand to ensure that appointments are kept. All vaccination sites, however, are expected to have plans in place for rescheduling appointments should they not have sufficient inventory. Additionally, with bad weather coming tomorrow, all sites have contingency plans in case they need to reschedule appointments. As we have said before, getting as many individuals as possible vaccinated is vital to our fight against COVID-19, and this is particularly important given the concerns about the increasing number of mutations being seen in the virus. Viruses constantly change or mutate, and new variants of a virus are expected to occur over time. Sometimes new variants emerge and disappear. Other times, new variants emerge and persist. Currently, the only variant identified in New Jersey is the B.1.1.7 variant, the variant which emerged in the United Kingdom. There are a total of 50 cases of this variant in New Jersey. The department's Public Health and Environmental Lab is doing sequencing for all virus variants. The lab continues to increase its testing capacity and is also working with public and private partners to increase testing for variants. Additionally, the department participates in the CDC surveillance program, where specimens from New Jersey residents are randomly selected and sent to the CDC for sequencing. Sequencing is done in collaboration with local, state, and federal health partners on outbreaks with atypical transmission patterns, cases with international travel to areas where variants are prevalent, for example, Brazil and South Africa, and random samples of COVID-19 positive cases from the northern part of the state, the central part of the state, and the southern part of the state. The department also receives specimens from some commercial labs when their routine testing is suggestive of a variant. Other commercial labs are working with CDC, and there are other labs in our state that are doing sequencing, including Princeton University, Hackensack Meridian Health right now, and Rutgers University. We pay attention to any changes that may increase transmissibility, increase severity, or show resistance to the vaccines. That is why we work to identify and track variants. When variant cases are confirmed, local and state public health officials perform a public health investigation, and that includes contact tracing. Contacts are notified and advised to quarantine. So far, studies suggest that antibodies generated through vaccination with the currently authorized vaccines will continue to prevent serious illness and slow the spread of the virus. Impact of vaccine on new variants is being closely investigated, and more studies are underway in this regard. The variants seem to spread more easily and quickly than other variants, some variants, which may lead to more cases of COVID-19, which is why it is vital that we continue to practice the public health measures that are proven to reduce the spread of the virus. Mask up, physically distance, wash your hands for at least 20 seconds, stay home if you're sick, and get tested. As a reminder, correct and consistent masking is an important step everyone should take to prevent getting and spreading the virus. Make sure your mask fits snugly against your face. Gaps can let air with respiratory droplets leak in and around the edges of the mask. Pick a mask with layers to keep your respiratory droplets in and others out. A mask with layers will stop more respiratory droplets getting inside your mask or escaping from your mask. Use a cloth mask that has multiple layers of fabric. Wear one disposable mask underneath your cloth mask. The second mask should push the edges of the inner mask against your face for a tight fit. Another important tool for controlling the spread of COVID-19 is contact tracing. If a contact tracer calls you, please take their call. Answer their questions to help protect yourself, your loved ones, and your community. As the governor shared, the updated version of COVID Alert NJ app is now available. If you haven't already, please take the time to download the app. It is now available in 10 new languages. The more individuals who have the app on their phone, the more valuable the app is in our fight against COVID-19. So moving on to my daily report, as the governor shared, our hospitals reported 2,370 hospitalizations, with 411 of those individuals in critical care. 75% of the critical care patients are on ventilators. This is the lowest census we have had since mid-November. There are no new reports of multisystem inflammatory syndrome in children since the 15th. On the 15th, we reported 4 new positive cases. There are 92 cumulative cases in the state. And the children affected have either tested positive for COVID-19 or have had antibody tests that were positive for COVID-19 exposure within 4 weeks prior to their symptoms. One of these children is currently hospitalized. Fortunately, there have been no deaths. The breakdown of race and ethnicity of these cases is as follows: white 23%, black 24%, Hispanic 41%, Asian 5%, and other 7%. The governor reviewed the new cases and deaths reported. In terms of deaths, the breakdown by race and ethnicity is as follows: white 55.6%, black 16.6%, Hispanic 18.9%, Asian 5.1%, and other 3.8%. At the state veterans' homes, there are no new cases among our residents. At the state psychiatric hospitals, there are no new cases among patients. However, and sadly, there has been 1 death related to COVID-19 complications among staff. That individual had not been working since December 21st. The percent positivity in the state as of February 13th is 10.8%. The northern part of the state, 11.57%. Central part of the state, 10.07%. And the southern part of the state, 9.95%. So that concludes my daily report. Stay safe. Continue to mask up. Double mask. Social distance. Stay home when you're sick. Get tested. And remember, for each other and for us all, please take the call and download the COVID Alert NJ app. Thank you.
Judy, thank you. One minor point and a question I'd love to throw to you and Eddie. First of all, folks, don't travel to Brazil and South Africa right now. I couldn't be clear about this. Frankly, don't travel, but don't go to those 2 countries. Please, there should be no travel to or from Brazil or South Africa right now. I'm sure someone will yell at me for that, for the consul generals from either of those countries who are good friends. Eddie or Judy, I was in Camden this morning, as I mentioned, having a very good conversation about COVID, vaccine, progress, et cetera. And I didn't make this sort of a definitive statement, but I said to a couple of the folks down there, but for the variant, I think we would be planning right now a much more, I'm going to use the word aggressive, but a much more fulsome series of steps to reopen over the next few weeks. But the variant sort of hangs over our head. We know it's more easily transmitted. We know the vaccines still work against, to your words earlier, I think, against severe illness and death, but they work less well than they do against the main virus. And the science is incomplete. So it's not just a question of we don't have clarity. I don't think anyone in America does right now on how much hold it will take and its impact. but also the science associated with it continues to be incomplete. Would you quibble with any of those observations, and would you, or Eddie or Judy, would you add anything to that?
No, I think that's accurate. I think the difficulty here is making policy decisions when you don't really know what's coming. And when I say what's coming, I'm talking about the incidence of disease, and the burden of disease on the healthcare system and on everyone. So the trajectory's been really tremendous in the last month. It continues to go down in terms of cases reported, in terms of hospitalizations, ICUs, and everything. And even with the increasing prevalence of the variant, particularly the one that we're seeing in New Jersey and mostly in this country, which is the B117, which seems to be actually perfectly resistant, if you will, or sensitive to the vaccine. In other words, we're not really seeing that the vaccine is less effective against that. And as long as we continue to do everything we've been emphasizing, over the last year, Judy mentioned them in her remarks, and at the same time increasing our vaccination rates, we're going to continue heading in the same direction. And I think at some point, those decisions about loosening the restrictions still have to be made, even though we're concerned about the variants, as long as we're monitoring them, as long as our surveillance system is robust and we continue to do the testing and the sequencing. At the same time, being ready to stop and reverse course if necessary, and which is really what you've done over the last year.
I mean, going backward is something we've tried to avoid like the plague, no pun intended here, and we want to continue to try to avoid going backward. If we had to, we would, obviously. We've frozen steps. Remember, we were going to open indoor dining sometime in late June, as I recall, and we had to unfortunately hold that back till September 4th, so well said. Again, that echoes what Tony Fauci advised us in private and in public. Keep doing the basic stuff, keep your vaccine rollout going, and ultimately this is going to sort its way through. But between now and then, of course, is something that we've got to manage. Pat, we got more weather coming. I know ABC was out there aggressively, but I have to take a moment of personal privilege here. I learned something last night from my colleague in Texas. I think he was on Sean Hannity on Fox. Because we looked down and they had, I think, 3 million outages, something like that in Texas. We had 13,000. Clearly the storm was less brutal here. And by the way, we don't wish any ill will to the great folks in Texas. In fact, we've got relatives in Texas, so we wish them nothing but the best. But I'd stupidly, since I've been in this position all along, have thought that it was, why do you get power outages? I thought it was overgrown vegetation, it was ice and snow and high wind. Come to learn last night from my colleague in Texas, it's actually due to solar power, wind power, and the Green New Deal, which I had missed that. So it just goes to show you, you could learn something no matter how many times you've been around the block. So with that, Pat, over to you with a little outlook on weather, compliance, and other matters.
Thank you, Governor. Good afternoon. ABC was out over the weekend. They were down in Cape May as well as in Middlesex County. They did not come across any violations in Cape May, but the following 7 establishments in Middlesex were Riverside Sports Bar in Perth Amboy, Pagodas Place in Perth Amboy, Passions Nightclub, Perth Amboy, Courthouse Inn in Perth Amboy, Portuguese Manor Restaurant, Perth Amboy, Yu Sushi in Woodbridge, and Cafe Luna in Old Bridge. And those were basically a combination of no facial coverings, over the 35% capacity, no social distancing, and sitting in a bar, combination of all of those things. And I'll also note that ABC is also issuing charges against the Luba Lounge in West Orange, seeking to revoke their liquor license. I went through them this morning. That establishment has been cited 28 times for EO violations, and because of that establishment's repeated noncompliance and egregious behavior, ABC is seeking to revoke their liquor license. And with regard to the weather, here we do go again. I'll be on a call with the National Weather Service and our county and state partners this afternoon. It looks like that typical Jersey storm where that rain snow line is north of the center of the state, upwards of 8 inches. Some models are calling for a little bit more, and then below a wintry mix somewhere from the 1 to 4 inches. It's going to be a sticky commute from what I understand from the timing, Governor. It looks like the commute's going to be upwards of an inch falling per hour tomorrow morning. So we're on top of it. I was on with Commissioner Gutierrez Schichetti just right before I walked in here. We'll be ready for it, and just another weekday in Jersey, Gov. Thank you.
Thank you, Pat. Don't forget what causes power outages.
That's right.
Keep that in mind, those damn windmills.
We'll
man.
tell Joe
Pesky little
Fiorelliso.
things. A couple of things. ABC, and they don't telegraph when they're going or which county, but it's pretty clear by the list, and we heard this before in Monmouth and on Burlington, I know. They basically do a county strategy, right? When they go out and blitz it, they do it in a compact, which allows them to hit more places more easily, right? So that's number one. And folks, please, come on. I mean, most folks in most establishments are really doing the right things. We just need everybody to do it, and 28 EO violations ain't the way to get from here to there. And then lastly, on weather, I think we're almost, for our members, our brothers and sisters in the press, I'll be very surprised if we're not at the STEMC tomorrow morning in the Ford section of Woodbridge with Diane and you and Jared and me and probably Joe Fiorelliso. So we'll probably be tomorrow in a virtual mindset, and my guess is we'll be doing something first thing in the morning. The commute tomorrow looks like it's going to be messy, right? So, and your point is we've got this Route 195 sort of almost magical delineation in the state. So stay, folks. So stay safe, folks. Ready.nj.gov continues to be the best all-encompassing website. And if you're taking a bus or a train on NJ Transit, I would go to njtransit.com to get your specific line implications. The other thing about this storm, it doesn't feel remotely as intense or as big as the one we had a couple of weeks ago, but it does share, at least at the moment, and I know you're going to get an update this afternoon, the characteristic of being a long storm. So tomorrow morning through sort of midday Friday, is that fair?
That's correct,
Yeah. And that's sort of, that's an exposure that just by its nature, if you're on the line and it tilts more snow than rain, that's a pretty significant exposure. So in any event, stay tuned. My guess is we'll be gathering at the Storm Management Center tomorrow morning. My guess is if I had to predict, it'll be around 9 o'clock if I had to put a fine point on it. We'll be back here again, somewhat depending on the storm. So we're going to stay with our Monday, Wednesday, Friday routine. This is somewhat related to weather, but assuming weather provides, we'll be back here at 1 o'clock in person on Friday. Let's start in the back. Let's go relatively quickly because we got a full house here today. Please, ma'am.
Hi, Lilo Stainton from NJ Spotlight News. Thank you
Hey,
for
Lilo.
Remembering Edwina. She was a special person.
She was.
Yeah. 3 questions related to the vaccine. Yesterday, Dr. Fauci told CNN that Johnson & Johnson will have considerably fewer doses available by April than they thought. Meaning the general public won't have access until mid-May or June, possibly even July, he said, or I guess President Biden said. How does that affect your plans to deploy that vaccine, particularly to harder-to-reach communities?
Was that Johnson & Johnson you said?
Yep.
Okay.
J&J. On a call, second question, on a call with governors, Biden administration said that they anticipated only a few million doses of the J&J vaccine when it is approved or gets the EUA. So fewer upfront and fewer and later, and a delay in delivery on the end. Can you provide some more details on that? Third question, are you concerned about changes in the timeline adding to people's frustration and the sense that perhaps public expectations around the vaccine rollout and supply were set too high? Thank you.
Thanks for what you said about Edwina. I don't know that we've got a whole lot more insight. I mean, the feds are the ones that are dealing directly with Johnson & Johnson. Obviously, we're proud of the fact they're an iconic New Jersey institution, We had set out, and Judy, if I get any of this wrong, as I'm sure I will, you'll come in and correct the record. We had said our aspiration was 70% of our adult population within 6 months, which translates into 4.7 million people vaccinated. And I think we've said here a number of times, even putting aside the J&J reality, that the prior federal administration had left the cupboard a lot barer than they had indicated. The Biden team was making great progress, which is still very much the case. But that 6 month window still felt plus or minus right. I mean, I'm not sure we'd want to be held to a day, but it clearly feels like it's much more middle to back end loaded, especially when you add the J&J reality on top of Moderna and Pfizer already. As these folks, the experts to my right, will tell you, a more even cadence in that 6 month period is preferable, particularly when you've got the 2-shot vaccines where you've got to be, you've got to track that. But I don't know that we've got, and I'll defer to Judy if she's got more insights on this. I don't think the public expectation in New Jersey is too high, because I still feel like we're plus or minus, we still think we'll get there. Whether it will be, is there a window that really is realistically Memorial Day into the 4th of July till we get to the many millions more, perhaps? But we're going to do everything we can and find every dose that we can as soon as we can. I don't think the expectations are too high. There's no question there's a supply-demand imbalance. And there are lots of people who are getting their vaccines overwhelmingly come to us and say it was an extraordinary experience. Just it runs like a Swiss watch. You hear all these great stories. The problem is getting in the door. And that remains a problem. There's no question about it. Anything you want to add?
I think it's important to note that we have about over 1 million people that have gotten their first doses. We have 2.5 million people pre-registered to get in line. So if you give us vaccine, and with the number of points of dispensing in New Jersey, we could easily get up to 3.5 million people vaccinated in a short period of time if we had the vaccine. And remember, the 70% is 4.7 million. So we would be pretty far along on our journey.
You're in the neighborhood. And I think one of the points back to what Eddie said earlier, you've got a number of curves here that are going to begin to crash in each other. Better weather, the epidemiological curve, the variant wild card, vaccines racing to get out ahead of any variant fallout, all that. I'm going to predict April to June. A lot of stuff is going to come into real clear vision. Thank you for that. Dustin, real quick, ma'am.
Real quick, when you say six month period, when is your timeline starting?
I think we've been in this sort of, and I would sort of say this is, we started sort of December. So I think it's Memorial Day, 4th of July window would be my guess. Eddie, please.
It's I mean, it goes back and forth about really, it's hard to say how many doses we'll have. I think it's fair to say, though, that we haven't been counting our doses from the J&J vaccine, because we really haven't known what's going to be available at the time that there's likely to be an emergency use authorization. They're meeting next week. All the data that we've seen so far has been from the J&J's press release. So we actually haven't seen the granularity of the actual scientific data, and we're anxiously waiting to see that. It'll be a week from Friday. We expect to actually see the data posted online maybe Wednesday. And then I'm sure around that time, J&J will actually come out and tell us with the government of how many doses will actually be available and when, because they haven't said when they'll start to ship as well. But we never expected a lot of vaccine to begin with from J&J.
One of you asked this and we didn't answer it, but there is tell me if you all disagree with this, and we got to keep moving here. J&J, if it is approved, if it is as safe and efficacious as the early indications or claims are, is a one-shot vaccine with regular refrigeration. That does afford an enormous amount of flexibility for us collectively to get into hard-to-reach places, because you don't have to worry about this cold chain storage or scheduling the second appointment. That gives you a nimbleness that right now the system doesn't really have. We've got a massive distribution system that needs a lot more supply, but it's sort of a metronome. You've got to be very careful on how the first and second doses are scheduled, administered, et cetera. If, again, it's an if, Eddie, if the J&J comes out the way they think it will, that is an element of flexibility that we don't have at the moment. Is that fair? Okay, thank you. Dustin, good afternoon.
Good afternoon. Why are cases and hospitalizations going down, but the RT is going back up? And could that be reflective of the more contagious variant? Is the Labor Department having problems again getting the 11-week unemployment extension out? And if so, what's the issue and when can people expect that to be resolved? Governor, what was your understanding of the visa arrangements Sky Blue had with Global Premier Soccer, and were you aware that they could potentially be illegal? And lastly, can somebody just explain how the administration calculates what qualifies as a nursing home death? Specifically, how are nursing home residents who die at a hospital classified, and how can the public be assured that the administration is not undercounting? Thanks.
I will defer to Eddie and Judy on I'm glad you asked it because this is one we get a lot. Hospital rate going down, RT rate is really still been in a range, but it's started to creep up a little bit. I think part of the reason is it's a look back over a 7-day period, and the hospitalizations are what they are last night. But Labor Department, I've got no insight on that. If I can come back to you on that, I'm not aware of that. But if it's, do you have anything on that, Paramel? Okay, if we can come back to you, we will. As it relates to Sky Blue, I saw the same press as you all did. This was a program, as I understand it, that was recommended to teams by advisors to the league. If I read the article right, I think 7 teams ultimately participated in it. I don't have a whole lot beyond that to add. I think either the team has or will put out a statement. I do want to reiterate the reason why we went into this is the reason why we're still in women's soccer today, and that is, you know, when our daughter was younger, not that I think she ever had an aspiration to be a pro soccer player, but it was notable that the young boys, including our sons, could look up to pro soccer athletes in the U.S. at a major league level, and you couldn't if you were a young girl, which was made even crazier because we were the #1 national team and continue to be top couple in the entire world. And that's why we went into it, and that's why we stay in it. I noted this morning, I think it was this morning, I saw that there's a Washington franchise which is getting stood up with some really cool people. Jenna Bush, Chelsea Clinton, who we hosted for the Women's World Cup in Germany, Brianna Scurry, former national goalkeeper, also we hosted in Germany for a clinic. So I hope that's a sign of a trend that the girls can continue to look up and see women playing professional soccer, right standing with great pride alongside the men. So any other observations on either hospitalizations coming down, RT up a little bit? I think it's due to timing lag, but also the last question Dustin asks, categorization of nursing home deaths. You know, one of the things that I think we take great pride in, we have been as upfront and as explicit about losses of life, including over a couple of thousand probable deaths from COVID-19, and we've never wavered from that, and we never will. But the specific question of how is that characterized? I assume this is the question, someone's in a nursing home, they get sick, they need hospitalization, they go, sadly, God forbid, but they pass. Are they counted as a hospital death versus a nursing home death?
Well, the deaths are categorized by residents. They are definitely categorized as a nursing home death. And they're captured both in the confirmed, lab confirmed, and the probables.
Anything on, Eddie, on RT?
No,
up a little bit, and hospitalizations coming down.
Yeah, I agree with you on that. The timing is important. The other thing is that we have been more and more using monoclonals in the state. We have a program, a dedicated program in the department that's basically coordinating the use of the monoclonals around the state and distributing it from the federal government. Now, what the extent of the impact is hard to really measure, but the use of the monoclonals are to prevent hospitalizations, and so that's going to contribute to some extent.
Thank you for that. And as usual, Rob Sarangelo is watching. So Dustin, here's the answer he just gave to me, and I will give you the verbatim. There are no problems with the 11-week extension getting out. Certainly, there are people who got the 11-week extension added to their claim that had some other issue. Thank you for that. Thank you, Rob. Brent, good afternoon.
Good afternoon. Sorry, hold on one second. Will you close any of the mega sites tomorrow because of the storm? And how would appointments be rescheduled? And what about rescheduling appointments at other locations that close? A new Pew study says all but 7 states have seen tax revenue drop because of the pandemic, and 6 of the 10 with the biggest drop have Republican governors. What does that say about the need for the $350 billion in state aid and the Republican claims of a blue state bailout? And lastly, what is the county-by-county breakdown for the new variant cases?
On mega sites, I don't think we've made any determinations yet, unless Judy or Pat correct.
I do know that Burlington and Morris are going to be closed tomorrow, Brent, and that the Somerset community-based site is also going to be closed. Other than that monster storm, we've kind of deferred to the site coordinators to make that determination. Thank you.
Thank you for that. Hot off the press. I think folks should go to the website, covid19.nj.gov/vaccine, if there's any question about whether a site is open or appointments. Brett, did someone on my team slip you something to ask the question about the Republican governor states that had their, you said this, of the 7 that went down, the most, 6 of them were Republican governors? 6 Republican. Listen, I would say, we've been saying, this is not to pick on them or not, but we've said from moment one that the need for state and local aid has nothing whatsoever to do with blue state, red state, legacy issues. It's keeping frontline workers employed, delivering the services that we desperately need in this hour of need. You know, firefighters, police, educators, healthcare, EMS, you name it. I don't have anything beyond that other than to say it's an American state challenge, and it's not purview to one party or another. Judy, I believe you do have the county by county UK breakdown. Is that right?
The breakdown is all B117 variants. Total reports: Atlantic 1, Burlington 4, Essex 7,